Good day, everyone. I am Carlos Sete Morante, and along with my partner, Ms. Wenzel Grace Diondak, today we are going to discuss assisted reproductive techniques. But before we start with the discussion, I will first introduce to you some common terms that we will encounter throughout the discussion. So first is egg donors. Egg donation is when a woman or the donor gives their eggs to another woman or the recipient to allow the recipient to have a baby. We can meet this when a woman who wishes to become a mother has problems with her ovulation or has complications that enables her to produce a functional egg. Sperm donors. Sperm donation involves a fertile man giving or selling his sperm so it can be used by an infertile individual or couple. So when can we say that a man is infertile? A man is said to be infertile when his sperm motility is less than 40% and his sperm production is only less than 13 million milliliter per semen. So we know that the normal sperm production ranges from 15 million to 200 million per sperm per milliliter of semen, while normal sperm motility is 40% and above. So, sperm motility refers to the ability of sperm to move or swim efficiently through the female's reproductive system in order to fertilize an egg. Frozen embryos refers to the process of freezing one or more embryos to save them for future use. The embryos are frozen and can later be thawed and placed in a woman's uterus. So in instances where there are a lot of embryos that were not used during the procedure, they can be frozen to be used in the future. Surrogate carrier. Our traditional surrogate refers to a woman who shares a genetic link to the child. It is the person who becomes pregnant with sperm from one partner of the couple. So we will encounter this when a woman has complications that makes her unable to produce a functional egg, or where she has a complication that makes her unable to bear a child, which is why they are going to ask for egg donors, and using the sperm of their partner, they're going to fertilize it in a lab, then transfer it to the surrogate carrier, which is why it was mentioned here that it refers to a woman who shares a genetic link to the child. This is also common in LGBT couples. Next is a gestational carrier. A woman who carries and delivers a child for another couple or individual, aka the intended parents. She does not have any biological connection to the child. A person who becomes pregnant with an egg from one partner and a sperm from the other partner. This is commonly observed in a woman who wishes to become a mother, but because they have certain complications that enables them to bear a child, they are going to inquire gestational carriers.
Assisted reproductive technique. So according to the 1992 Fertility Clinic Success Rate and Certification Act, Assisted Reproductive Technology or ART includes all fertility treatments in which either eggs or embryos are handled. In general, ART procedures involve surgically removing eggs from a woman's ovaries, combining them with sperm in the laboratory and returning them to the woman's body or donating them to another woman. ART is used to treat infertility. It includes fertility treatments that handle both eggs and sperm. So, the 1992 Fertility Clinic Success Rate and Certification Act is a United States federal law that regulates fertility clinics that offer assisted reproductive technology services. ART refers to a range of fertility treatments that involve handling either eggs or embryos outside of the human body in laboratory setting. ART procedures involve surgically removing eggs from a woman's ovaries, which is known as oocyte retrieval. The eggs are then fertilized with sperm in a laboratory dish, and the resulting embryos are either transferred back into the woman's uterus or will be donated to another woman who is trying to conceive. And ART procedures may include in vitro fertilization or IVF, intracytoplasmic sperm injection or ICSI, and other techniques that can help individuals and couples who are experiencing fertility problems to conceive. The goal of ART is to help people achieve a successful pregnancy and childbirth, and it has become a widely used option for people who are struggling with infertility. So we have here several types of assisted reproductive technique. We have artificial insemination, in vitro fertilization, gamete intrafallopian transfer or GIFT, then zygote intrafallopian transfer or ZIFT, surrogate embryo transfer, and pre-implantation genetic diagnosis. So the first three types of techniques will be discussed by Mr. Morante.
So in artificial insemination, a doctor inserts sperm directly into a woman's cervix, fallopian tubes, or uterus. It makes the tip shorter for the sperm and gets around any obstructions. Your doctor may suggest this method first as a treatment for infertility. The most common method is called the intrauterine insemination or IUI, when the doctor places the sperm in the uterus. So in artificial insemination, there are three types. First is intrauterine insemination. So in intrauterine insemination, the small vesicle is prepared in the laboratory, then it is injected inside the uterus with catheter after stimulating the ovaries to produce more eggs per cycle. The catheter used here is the Tomcat. Next is the intracervical insemination. It involves the injection of the unwashed or raw semen into the cervix with a needleless syringe. A vagina speculum is used to hold the vagina so that the cervix may be observed, and then the syringe is inserted. The plunger is pushed upward and the semen is emptied deep in the vagina. So last is the intratubal insemination. It involves the injection of the washed sperm into the fallopian tube. It should not be confused with a gift, where both eggs are mixed outside the woman's body and then immediately inserted into the fallopian tube. So intratubal insemination is less used than intrauterine insemination. So the three types of artificial insemination basically just refers to where the doctor would insert the sperm. If the doctor would insert the sperm through the woman's uterus, then it is called the intrauterine insemination, which is the most common. Then, if the doctor would insert the intracervical insemination, it basically just means that the doctor would insert the sperm in the woman's cervix. While if it is in the woman's fallopian tube, then it is called the intratubal insemination. So it was mentioned that assisted reproductive techniques are used to treat infertility. But what are the types of infertility treated by artificial insemination? In male infertility, oligospermia or low sperm count happens when a man only produces 13 million sperm per milliliter of semen. Then, when the sperm aren't strong enough to swim through the cervix and up into the fallopian tubes, which refers to the sperm motility. In male infertility, endometriosis, which is a disease in which the tissue similar to the lining of the uterus grows outside of the uterus. This usually is caused by retrograde menstrual flow, then abnormalities in reproductive organs, for example, blocked fallopian tubes. The next is unreceptive cervical mucus. So the procedure will start by your doctor using ovulation kits, ultrasound, or blood tests to make sure you're ovulating when you get artificial insemination. Then your partner will need to provide a sample of their semen. The doctor will suggest that your partner avoid sex for 2 to 5 days before the procedure. This is to increase the sperm count. If you live close to the clinic, your partner may be able to collect a semen sample at home. If not, they'll do this in a private room. This is because the semen has to be washed within 1 hour after ejaculation. The process of washing the sperm in a lab removes chemicals in the semen that may cause discomfort for a woman and raises the chances of getting pregnant. Technicians liquefy the sperm at room temperature for 30 minutes and add a harmless chemical to separate out the most active sperm. They use a centrifuge to collect the best sperm. Those are placed in a thin tube called a catheter and put through your vagina or cervix or into your fallopian tube into the uterus. So what are the reasons why the chances might be lower that it will work? Older age of the women. So we know that women age 35 and above, they have less chances of getting pregnant and having a successful pregnancy. Poor egg or sperm quality. Severe case of endometriosis and a lot of damage to fallopian tube, usually from long-term infections. Advantages of artificial insemination. Similarity with natural conception. Unlike IVF cycles where the patient eggs are extracted by follicular puncture and subsequently fertilized in the laboratory, and artificial insemination, fertilization occurs inside the woman's body. Simplicity and low cost. Artificial insemination can be performed in the gynecologist's office itself, without the need to go to the operating room. It is very simple, fast, and comfortable technique for the patient. The process of introducing the cannula through the cervix to perform artificial insemination is painless and does not require anesthesia. Advantages derived from the technique itself. It increases the chances of gestation compared to natural conception due to the slight ovarian stimulation. The control to perform the insemination close to the ovulatory period. The process of the semen sample and the production of the sperm directly into the uterus. It allows a single woman and couples formed by two women to become mothers through the sperm donations. So what are the disadvantages of artificial insemination? First is the requirements. The fallopian tubes must be functional, as this is where fertilization will occur. The woman must have not any problems that prevent her from ovulating spontaneously or induced by hormonal medication. The quality of the spermatozoa must be good and present favorable results or only slight alterations in the semen analysis. In addition, our REM or motile sperm count greater than 3 million progressive motile sperm is recommended after processing of the semen sample. So next is success rate. In the latest National Activity Registry of the Spanish Fertility Society, or SCF for 2020, the gestation rate per cycle for artificial insemination stands at 16.9% in women under 35 years of age. However, the delivery rate per cycle is only 13.5% for women of the same age group. Then it's risk. Ovarian hyperstimulation syndrome, multiple pregnancy, ectopic pregnancy, infections, or allergic reaction. So when compared to other assisted reproductive techniques, artificial insemination is not that effective. Then the next are assisted reproductive techniques that I'm going to discuss is in vitro fertilization or IVF. In vitro fertilization or IVF is a complex series of procedures used to help with fertility or prevent genetic problems and assist with the conception of a child. During IVF, mature eggs are collected or retrieved from ovaries and fertilized by sperm in a lab. Then the fertilized egg or embryo or embryos are transferred to uterus. One full cycle of IVF takes about 3 weeks. Sometimes these steps are split into different parts and the process can take longer. So in vitro fertilization, its procedure is comprised of ovulation induction, egg retrieval, sperm retrieval, fertilization, and embryo transfer. So in ovulation induction, before the procedure, a woman is given an ovulation stimulation agent such as GnRH or clomiphene citrate clomid or human menopausal gonadotropin or perigonal. Beginning about the 10th day of the menstrual cycle, the ovaries are examined daily by ultrasound to assess the number and size of developing ovarian follicles. When a follicle appears to be mature, a woman is given an injection of human gonadotropin, which causes ovulation in 38 to 42 hours. The next is egg retrieval. A needle is then introduced intravaginally guided by ultrasound, and the oocyte is aspirated from its follicle. Because of the drug given to induce ovum maturation, many oocytes may ripen at once and perhaps as many as 3 to 12 can be removed. The oocytes are incubated for at least 8 hours to ensure viability. Next is sperm retrieval. If you're using your partner's sperm, a semen sample needs to be provided at your doctor's office or clinic to monitor off-egg retrieval. Typically, the sperm sample is collected through masturbation. Other methods is testicular aspiration. Then donor sperm can also be used. Then the next step is fertilization. Fertilization can occur in two ways, either by conventional insemination or intracytoplasmic sperm injection. During conventional insemination, healthy sperm and mature eggs are mixed and incubated overnight, while in intracytoplasmic sperm injection, or ICSI, a single healthy sperm is injected directly into a mature egg. ICSI is often used when semen quality or number is a problem or fertilization attempts during prior IVF cycles failed. Then lastly is embryo transfer. Only one or two fertilized eggs are chosen and transferred back to the uterine cavity through the cervix by a means of a thin catheter. So indication, in vitro fertilization is commonly used as primary treatment for infertility in women over age 40. Then, if a woman has health conditions such as fallopian tube damage or blockage, ovulation disorders, endometriosis, and oligospermia. So what are the advantages of in vitro fertilization? So in vitro fertilization helps patients who are unable to conceive, such as those who has blocked tubes, older patients, or patients with low ovarian reserve, male infertility, and endometriosis. IVF has also been used for a long time and has a safe track record. Compared to other art techniques or art, it is the most successful, and IVF helps women, single women, and LGBTQ plus couples. While its advantages in vitro fertilization are associated with side effects and risks, such as multiple pregnancies. There is also evidence that high estrogen levels associated with high simulation of IVF can increase the risk of prematurity and low birth weight in babies. IVF treatment can take an emotional or psychological toll. So it was previously mentioned that IVF has risk. So those risks refers to multiple pregnancies, premature delivery and low birth weight, ovarian hyperstimulation syndrome, miscarriage, and ectopic pregnancy. Multiple birth occurs because a number of embryos is inserted in the woman's uterus, and the greater the number there is, the less they are able to survive. Premature delivery and low birth weight, ovarian hyperstimulation syndrome. So this refers to the exaggerated response to excess hormone. Usually occurs in women taking injectable hormone medication to stimulate the development of eggs in the ovaries. Ovarian hyperstimulation syndrome causes the ovaries to swell and become painful. Then miscarriage and ectopic pregnancy. The next is gamete intrafallopian transfer. In gamete intrafallopian transfer procedures, ova are obtained from ovaries exactly as in IVF. Both ova and sperm are instilled within a matter of hours using a laparoscopic technique into the open end of a patent fallopian tube. Fertilization that occurs in the tube and the zygote moves to the uterus for implantation. This procedure has pregnancy rate equal to that IVF. The procedure is contraindicated if women's fallopian tubes are blocked because this could lead to ectopic or tubal pregnancy. GIFT or gamete intrafallopian transfer is used for those couples who have unexplained infertility, and then if IVF without success. And for both spouses have religious or ethical factors that cannot accept IVF. GIFT procedure would start by the patient first needs an X-ray to make sure that at least one of the fallopian tubes is healthy. The doctor will do a laparoscope to ensure that there is no scar tissue outside the fallopian tube. A laparoscope is used to remove the egg from the ovary. When the egg is taken out, the man provides a sperm sample. Then the eggs and sperm are mixed in a catheter. The mixed sperm and egg will be put into the fallopian tube through a catheter. Medicine will be provided to women to help build the endometrium and help implant the fertilized egg. So what are the advantages and disadvantages of gamete intrafallopian transfer? First is because the fertilization happens inside our body instead of a petri dish, the success rate of a gift is relatively high. Experts think that the journey through this fallopian tube nourishes the new embryo, giving it a better chance of being healthy and able to implant it in the uterus. Another reason for the increased success rate could be timing. The embryo arrives at the right time for implantation as opposed to IVF, in which the embryo arrives in the uterus when the doctor places it there, and that may not be the right timing for her body. Then its disadvantages or doctors cannot visually confirm fertilization or determine the quality of embryos. Women with blocked or damaged fallopian tubes are not able to perform gamete intrafallopian transfer. Associated with risk or side effects of gamete intrafallopian transfer are risk for laparoscopy, which may be used to transfer eggs, include pelvic infection, puncture of internal organs, and side effects from general anesthesia. And assisted reproductive technologies, including GIFT and ZIFT, increase the risk of multiple births. A multiple pregnancy is high risk for both the mother and the babies.
The zygote intrafallopian transfer or ZIFT. ZIFT involves oocyte retrieval by transvaginal ultrasound-guided aspiration followed by culture and insemination of oocytes in the laboratory. Within 24 hours, the fertilized eggs are transferred by the laparoscopic technique into the end of a waiting fallopian tube. So zygote intrafallopian transfer or ZIFT is a type of assisted reproductive technology procedure that involves a combination of surgical and laboratory techniques. So ZIFT versus GIFT. So ang zygote intrafallopian transfer and gamete intrafallopian transfer are both type of assisted reproductive technology procedures that involve the transfer of eggs and sperm into a woman's fallopian tubes. However, there are some important differences between the two procedures. In ZIFT, eggs are retrieved from a woman's ovaries and fertilized with the sperm in the laboratory to create early-stage embryos called zygotes. The zygotes are then surgically transferred into the woman's fallopian tube using laparoscope. Then, this procedure allows healthcare providers to confirm that fertilization has occurred before the zygotes are transferred into the fallopian tube. On the other hand, in gamete intrafallopian transfer or GIFT, eggs and sperm are mixed and immediately transferred into the woman's fallopian tube. Sa ZIFT ay zygote ang kitransfer. Di-sure pa nga fertilized na siya. Then diri sa gamete is diretso sa paghuman o mix sa eggs and sperm, gidirect dayon siya transfer sa woman's fallopian tube using a catheter. Then fertilization then occurs naturally into the woman's body as the eggs and sperm travel to the fallopian tubes. Unlike ZIFT, GIFT does not involve fertilization in the laboratory, which means that healthcare providers cannot confirm that fertilization has occurred before the eggs and sperm are transferred. So the main advantage of ZIFT over GIFT is that it allows healthcare providers to confirm that fertilization has occurred before the zygotes are transferred into the fallopian tubes. This can increase the chances of successful pregnancy as it ensures that only fertilized eggs are transferred. So in difference with the GIFT, there is possibility that some of the egg may be not fertilized, which can decrease the chances of successful pregnancy. Overall, both ZIFT and GIFT may be suitable options for couples who have difficulty conceiving, and the choice between the two procedures will depend on various factors such as the cause of infertility, the age of couple, and the couple's preferences. So indication. ZIFT is commonly chosen by couples who have failed to conceive after at least 1 year of trying and who have failed 5 to 6 cycles of ovarian stimulation with intrauterine insemination or IUI. So the procedure, the first step in ZIFT is similar to the ART procedures such as in vitro fertilization, where eggs are retrieved from a woman's ovaries using transvaginal ultrasound-guided aspiration. This involves using a small needle, using a small needle guided through the vaginal wall and into the ovary to aspirate or suction out the eggs. Ayan. After the eggs are retrieved, they are immediately mixed with sperm in the laboratory to allow fertilization to occur. Then once fertilization has taken place and the eggs have developed into zygotes, the zygotes are surgically transferred into the woman's fallopian tubes using a laparoscope, a thin lighted tube with a camera on the end that is inserted through a small incision in the abdomen. So, ZIFT advantages and disadvantages. More physiological-like procedure. ZIFT attempts to mimic the natural process of fertilization and early embryo development that occurs in the woman's body by transferring the fertilized egg directly into the fallopian tube. This may increase the chances of successful implantation and pregnancy. ZIFT reduces the time in the laboratory because fertilization takes place in the laboratory. The zygotes are immediately transferred into the woman's fallopian tube after the fertilization, reducing the amount of time the embryo spent outside of the woman's body. Then optimal synchronization with endometrial development. By transferring the embryos directly into the fallopian tubes, ZIFT allows for optimal synchronization between the embryo and the development of the endometrium, which may increase the chances of successful implantation and pregnancy. So we have also disadvantages. ZIFT requires surgery. ZIFT is a more invasive procedure than other types of assisted reproductive technologies, such as vitro fertilization or IVF or intracytoplasmic sperm injection or ICSI, because it requires laparoscopic surgery to transfer the zygotes into the fallopian tubes. This can increase the risk and cost associated with the procedure. The next is also higher percentage of ectopic pregnancies may occur because the embryos are transferred directly into the fallopian tubes. There is a higher risk of ectopic pregnancies where the embryo implants outside of the uterus. This can be life-threatening if not detected and treated early. Rate of multiple pregnancy may be higher than in other types of techniques. Higher rate of multiple pregnancies. ZIFT may increase the risk of multiple pregnancy, which can increase the risk to both the mother and the babies, as well as increase the cost associated with the pregnancy and delivery. Risk of ZIFT: ovarian hyperstimulation syndrome, OHSS. Ovarian hyperstimulation syndrome, or OHSS. ZIFT involves the use of fertility drugs to stimulate the ovaries to produce multiple eggs, which can increase the risk of OHSS. OHSS is a condition that can cause the ovaries to become swollen and painful, and this can lead to complications such as dehydration, blood clots, and kidney failure. Another risk is complications arising from laparoscopic surgery. Complication arising from laparoscopic surgery. ZIFT requires laparoscopic surgery to transfer the zygotes in the fallopian tubes, which can increase the risk of complications such as bleeding, infection, and damage to surrounding organs. Then another risk is high rate of ectopic and multiple pregnancies. High rate of ectopic and multiple pregnancies. Ang ZIFT may increase the risk of ectopic pregnancies where the embryo implants outside of the uterus, and multiple pregnancies such as twins or triplets. Ectopic pregnancy can be life-threatening if not detected and treated early, while multiple pregnancies can be increase the risk to both mother and then the baby, as well as this can increase the cost associated with the pregnancy and delivery. In ZIFT, it is important for couples considering ZIFT to discuss this risk and potential complications with their healthcare provider and to weigh the potential benefits against the risk before deciding on this procedure. The next technique is surrogate embryo transfer or SET. Surrogate embryo transfer is an assisted reproductive technique for a woman who does not ovulate. Once pregnancy occurs, it progresses the same as an unassisted pregnancy. So, surrogate embryo transfer or SET is an option for women who cannot produce viable eggs for conceptions or have difficulty with ovulation. In this procedure, a surrogate is a woman who carries the pregnancy on behalf of another woman. A surrogate undergoes embryo transfer with an embryo created through in vitro fertilization using eggs and sperm from the intended parents or donor. The embryo then implants and grows inside the surrogate's uterus, leading to pregnancy and childbirth. Indication: SET indicated for women who are unable to produce functional eggs or have problems with ovulation. This can be due to various reasons such as premature ovarian failure, surgical removal of ovaries, or ovarian dysfunction. SET may also be used for women who have medical condition that makes pregnancy unsafe, such as a heart or kidney disease. And also, some women may choose SET if they have experienced multiple failed attempts at in vitro fertilization or IVF, or have any history of recurrent miscarriage. The procedure of SET is first, the selection of a surrogate mother who has passed medical and psychological screening. Then, sunod is synchronization of the surrogate's menstrual cycle with the intended mother's or egg donor's menstrual cycle using hormones. Then, third, collection of eggs from the intended mother or an egg donor and fertilization of the eggs with the sperm from the intended father or sperm donor in the laboratory. Fourth is culture of the resulting embryos in the laboratory for several days until they reach a suitable stage for development. And fifth, transfer of one or more embryos into the uterus of the surrogate mother using a thin catheter. Then last, pregnancy test. Pregnancy test to confirm the success of the embryo transfer. Then, SET advantages and disadvantages. Advantages. Complete families, ability to have biological children. SET allows couples who are unable to carry a pregnancy themselves to have a biological children, and it is likely to be successful. Then allows for genetic connections, as the intended parents can use their own gametes, sperm or an egg, or those of a donor. Then disadvantages. Cost can be significant. SET can be expensive with cost for IVF, medication, and surrogate compensation adding up quickly. And then surrogacy can be complicated. The surrogate may face medical complications and risk associated with pregnancy and childbirth. Then, risk of surrogate embryo transfer. Ectopic pregnancy. The transfer of embryos to surrogate uterus may increase the risk of ectopic pregnancy, which occurs when the fertilized egg implants outside of the uterus, like planning. Multiple pregnancies. The use of fertility medication and transfer of multiple embryos may increase the risk of multiple pregnancies. which can be associated with various medical complications for both mother and baby. Then, experience mild cramping like bleeding or in rare cases, an infection. The transfer of embryos to the surrogate uterus requires a surgical procedure which is katong laparoscopic, which carries certain risks such as an infection, bleeding, and damage to surrounding organs. Then next is the pre-implantation genetic diagnosis. It is a laboratory technique or laboratory procedure. PGD is a laboratory procedure used in conjunction with in vitro fertilization to reduce the risk of passing on inherited conditions. The process helps potential parents prevent the birth of a child with a serious genetic condition, and the procedure for PGD is similar to that of in vitro fertilization, with an extra step to check whether embryos are affected by a serious genetic condition. Pre-implantation genetic PGD is commonly used in conjunction with in vitro fertilization to identify genetic abnormalities in embryos before they implanted in the uterus. The goal of PGD is to reduce the risk of passing on serious genetic disorders or chromosomal abnormalities to the offspring. Then indication. Some of the most common reasons for PGD are specific single gene condition. PGD is commonly used for couples who carry a known genetic mutation that can cause serious inherited conditions such as cystic fibrosis or sickle cell anemia. By identifying and selecting embryos that do not carry the genetic mutation, healthcare providers can help reduce the risk of passing on the condition to the offspring. Then next, structural changes of a parent's chromosome. Some couples may have structural changes in their chromosomes that can lead to miscarriage, stillbirth, or birth defects in their offspring. PGD can help identify embryos that do not have these structural changes, which can increase the chances of a successful pregnancy. Then families may also use PGD when a member of the family needs a bone marrow donor as a way to have a child who can provide matching stem cells. So if ang family members need a bone marrow donor, in some cases, families may use PGD as a way to have a child who can provide matching stem cells for a family member in need of a bone marrow transplant. So the procedure. Step 1, stimulation of the ovaries. The woman undergoes hormonal stimulation to encourage the development of multiple eggs in her ovaries. In step 2, collection of eggs from the ovaries. The eggs are retrieved from the woman's ovaries using a needle guided by ultrasound. Step 3, insemination or injection of sperm. The retrieved eggs are either inseminated with sperm or injected with a single sperm. Step 4, fertilization. The fertilized eggs are allowed to grow and develop in the laboratory for several days until they reach the blastocyst stage. Then step 5, embryo biopsy. A few cells are removed from each blastocyst for genetic testing. The biopsy can be performed using different techniques, including blastomere biopsy. It is the removal of 1 or 2 cells from the embryo at the 6 to 8 cell stage, or tropedoctoderm biopsy, the removal of a few cells from the outer layer of the blastocyst. Step 6, embryo testing. The cells that were removed from the embryos are tested for specific genetic conditions or chromosomal abnormalities. Step 7, embryo transfer. The embryos that are free of the genetic condition or chromosomal abnormality are transferred to the woman's uterus. If there is no abnormalities or any genetic conditions, they are free to transfer. Dayon, step 8. After that, a pregnancy test. A blood test is performed around 2 weeks after the embryo transfer to determine if the woman is pregnant. Then, procedure. Advantages and disadvantages. So the advantages, PGD can improve the selection of embryos and prevent the transmission of genetic abnormalities, as well as offer the option of gender selection, and this can optimize the chances of a successful pregnancy and reduce uncertainty of couples who may be at risk of passing on genetic conditions to their offspring. However, there are also some potential disadvantages associated with the procedure, such as additional time and cost, as well as invasiveness of the IVF procedure. Then, it is important to note that while PGD can improve the chances of success, there are no guarantees or promises of a successful pregnancy.
Nursing responsibilities with a focus on alleviating the identified nursing diagnosis, which is the situational low self-esteem related to seeming inability to conceive. This is because waiting to be accepted by census program and waiting for steps of obtaining the oocyte laboratory growth and pregnancy success is a major psychological strain. Couples report a feeling of social isolation during peacetime and awareness answering friends and family's question about the procedure. So nurses are in charge in supplying empathic support through these difficult times. This is done through doing the following assessment and interventions. So first is assess couples' lifestyle to identify areas in which they are successful. Interventions done is review and reinforce with client activities that they have achieved successfully. This is done to identify positive attributes which can provide a foundation for rebuilding self-esteem. The expected outcomes is a couple names at least 3 positive achievements, such as organizing at work or planting garden. Next is assess if there is a common interest that they could draw on. This is by doing the intervention, ask couple to propose a new activity that would interest both of them. This is done to begin a new activity which can eliminate total concentration on fertility management. The expected outcomes are couple names and begins to participate in a new activity by 2 weeks' time.
So assess if there is a common interest they could throw on. The intervention will be ask the couple to propose a new activity that would interest both of them. And we could suggest to the couple to try taking a cooking class together for them to explore new recipes, their new cooking techniques, and work together to create delicious meals. This activity not only allows them to spend quality time together, but also, according to my research, cooking can be a fun and therapeutic way to relieve stress and anxiety, which may help them to alleviate some of the pressure related to their struggle with infertility. The expected outcome will be that couple names and begins to participate in a new activity by 2 weeks' time. Assess whether couple understand why ovulation and conception occur. Understanding the basic of ovulation and conception can help them intercourse to coincide with the most fertile days of the menstrual cycle, which can increase their chances of conceiving. And also, if the couple understands the factor that can contribute to the infertility, they can take steps to address any underlying medical issues or make lifestyle changes that may improve their fertility. So the intervention discuss the new fertility measures being instituted, include both members of couple in discussions as appropriate. And the expected outcome will be couple discusses options they need to follow for fertility testing. And that's all. Thank you.